Hi everybody, today we're going to talk about bleeding. Okay, and there are 4 stages when dealing with bleeding. So we use the acronym SEEP, S-E-E-P. So S stands for sit or lay the person down. The reason we do this is because if they suddenly pass out with a sight of blood or faint or anything and they're standing up, then you've suddenly got a dead weight coming straight for you. Whereas if they're sitting or laying down, it's much easier to manage them and their body weight. Alright, so S is for sit or lay them down. Then the first E is for examine. Alright, so we have a very quick look at where they're bleeding. See if there's anything stuck in there. If there is, leave it in there, because at the moment it's possibly plugging whatever that it is that's bleeding. And by pulling out anything that's in it, you can maybe do more damage underneath. Okay, so leave anything that's in there, but as I say, E is for examine. And the second E is then for elevate. So if it's their arm, for example, you want to get them to hold their arm up, so they're elevating it, and then it's reducing the blood flow, all right, to that limb, so they're not losing as much blood. Also, if you've done step 1, which is sit or lay them down, okay, and if they're bleeding from their leg, you can quite easily prop their leg up with minimum of fuss, and again reduce the blood flow to that limb. All right, and then P is for pressure. You need to apply pressure to that particular limb, okay, to help try and clot and stem the blood flow. Now again, if you've completed step 2, which was to examine, if there's something sticking out, so say for example there's a shard of glass in their wound, then that will help you decide how you're going to do step 4, which is a pressure. Because if they've got a shard of glass sticking out, you don't want to put direct pressure straight on top. A, because you could injure yourself, but secondly, you could end up pushing that glass further in and causing them more damage. Okay, so you'd then apply pressure around that area, but not directly on top. Okay, so as I say, we use SEEP. So stage 1, sit or lay. Stage 2, examine. Stage 3, elevate. Stage 4 is pressure. Okay, obviously use your bandages that you should have in your first aid kit. You may have to do a bit of blue Peter in that, cut them maybe, adjust them slightly to deal with whatever is stuck in the wound, if there is anything in the wound. If there's not and it's a nice clean cut, then you can apply the bandages and pressure quite firmly till it clots. And then obviously, depending on the size, common sense says depending on the size of the wound and what's causing the wound, then you need to get the medical help. Could be just to your local GP to see the nurse, or if it's much worse, then you need to get them to hospital. Alright, so a very quick one using SEEP for your bleeding. Alright, take care, bye!